13th of October, and thank you for your patience and for coming back. Now, I've had a complete tsunami of comments on emails that just show the lack of trust in official news media, official reporting, and a lot of official bodies. So I want to look at this a bit today and think why this might be a problem. Some reasons this might be a problem. Let's start off by illustrating that with a bit of orientation at the same time. Now, I've just downloaded these from Our World in Data, new confirmed cases per million. So New Zealand remaining fairly low, Australia going up a bit of a report from Australia in a minute. Canada and Australia, similar numbers now actually. Now, Russia cases are going up. Look at this excellent reduction in cases in the United States, very encouraging, but Ireland we see going up a bit. And the United Kingdom cases are actually going up a little bit as we speak. So a mixed picture there, but looking good for the United States. But we know that the Russian number is underreported, which I want to come back to in a minute. Now, these are a number of patients actually in hospital. Now, again, the United States coming down nicely. Now, this is from Our World in Data. United Kingdom fairly flat, Canada flattish, and Ireland flattish, but we don't get the data on Our World in Data on from Russia, unfortunately. That's all that's available just now. Share of people who've received at least one dose. Now, Russia, we see it's about 33% of people have received one dose. But when we can compare that to other countries, we go up the United States, Australia, New Zealand, United Kingdom, Ireland, Canada, all way, way higher, even though the vaccine has been available for longer in Russia. But there's a definite lack of trust in Russia, which has caused issues. So if we look at that there, about 33% of people who've had at least one dose of vaccine. Then we go into Russia, and the percentage of people that have had two doses is not a lot different. It's about 31%. So there's a huge swathe of people there in Russia and not getting the vaccine at all. And then we see the other improving picture around the world. Australia and New Zealand going up really quite dramatically as their vaccination programme nicely kicks into gear. So let's look at why I think this is such a problem. This whole lack of trust thing. I've been thinking a lot about this. I don't think there's ever been such a crisis of trust since the end of the age of deference at the First World War. There's so many people just don't believe what's going on at the moment. And this is a problem. And we need to look at how we're going to work out what's true and what's not. But just before we do that, let's look at Russia, where there has been a crisis of trust, is a crisis of trust. Infections are going up, we know that. They're reporting 973 deaths. That was on Tuesday, I think. The data's a bit out of date. But some figures, some official figures for deaths are pretty well double that in Russia. So a lot of people have died. Delta variant, of course, widespread vaccine hesitancy. Only 33% of people had the first dose. Now, the big reason for this, I believe, is that in Russia, the Russians were, Russian scientists were, inspired by the Oxford AstraZeneca vaccine, and they produced that very quickly. And they started mass distributing it before they'd done the clinical trials. And everyone knew this. And people just didn't trust the vaccine because the trial data was not there. And this has just carried on in this vaccine hesitancy. So first dose, only 33% at the moment in Russia. Very, very poor levels. Now, this leaves 77, well, whatever it is, 67% of people unvaccinated as winter approaches. And this is really pretty serious. Now, there will be a level of herd immunity in Russia, of course, but there's still a lot of people are going to be infected who have no immunity. So the vaccine rolled out before the trials. That was their big mistake. People didn't trust it. People were told that the problem with coronavirus and COVID-19 is not that bad, which turned out to be wrong. There was a lot of misinformation and underreporting to begin with. People have been told that the government had won the war on COVID-19, which of course is patently untrue. On a separate note, Mr. Putin pulled out of the G20 meeting due to a diary clash. Now, there was an outbreak in the Russian government a couple of weeks ago, and there was a lot of isolating going on. But Mr. Putin was coughing all the way through an interview, and coincidentally, he had a diary clash just after that and couldn't make it to this rather important meeting on Afghanistan, but due to a diary clash. He's had 2 doses of Sputnik 5, so he should be fairly well covered. But I think from memory, he's 69. So Mr. Putin's at a relatively high risk, actually. So it's probably a good job he's had the 2 doses of vaccine. In Russia, generally at the moment, 8,000 people in ITU. But this is going to become worse. Now, just listening to DW News report, doctors in Russia saying that patients are becoming critically ill in 3 to 4 days rather than in the second week. That's a bad sign. We don't like the sound of that, especially as autumn approaches. Now, vaccine passports in Russia cost €70 apparently, whether you've had the vaccine or not. A lot of people don't want the vaccine, but they want the convenience of the vaccine passport. So you pay €70 and you get an online version showing that you're fully vaccinated. Patent corruption going on, because there seems to be a lot of widespread public misconceptions. Hygiene rules hardly followed, limited restrictions, limited mask wearing even indoors, because official information is not believed. This is the problem. So people are just buying their own vaccine passports because it's more convenient, not getting vaccinated, not following instructions because of this lack of trust, which is what I'm talking about today, really. People just aren't trusting what's going on. Bit of an Indian summer just now in Russia, but once that's over, cases are going to shoot up, unfortunately. Hospitals in Russia may cope. They did open a new infectious diseases hospital recently, but in the regions, hospitals are already full, and there's going to be, I believe, a lot of unnecessary deaths in Russia in regional areas, as people are just not going to be able to access healthcare facilities who aren't vaccinated. So that's one problem, this official government sort of misinformation that's been around. Now, another cause of mistrust is apparent or actual vested interest. So let me give one example of apparent vested interest here. So we know that Merck put out statements saying that ivermectin shouldn't be used for COVID-19 and intimated that there were safety risks associated with it in COVID-19, despite the fact that 3.2 billion doses, or was it 3.7 billion doses have already been given out. So massively used drug, but apparently safety concerns now. But molnupiravir, the new drug from Merck, is awaiting EMU approval, or they've applied for EMU approval. US government's paying $700 a course for this. Analysts at Harvard School of Public Health, King's College London, have found it costs just $17.74 to produce. So take away $17.74 from $700 and you've got what is the potential profit there. And Merck and Ridgeback could earn $7 billion in profits by the end of the year, apparently. That's at $700 a course, and Merck said it's expecting to make 10 million courses. Now, no one's making any accusations here. I'm certainly not. I'm not in a position to do that. But people look at this and they think, $700 a course, just a minute. Is there vested interest here? This is the way people are thinking at the moment. People have become somewhat suspicious of what's going on. Another example is controlling factors. So this is BBC Media Action, for example. And this is the Bill and Melinda Gates Foundation. And this says they've given £1,569,100,000 to, this is the kind of circle of their funding, and this is the bit that the Bill and Melinda Gates circle of their circle that they've paid. That's well over £1.5 million in 2019, 2020. So, people often don't understand why the Bill and Melinda Gates Foundation is giving BBC Media Action very large sums of money. Why is this? Is it purely philanthropic endeavour, or is there some other reason? Now, I'm not saying there's any other reason, but a lot of people suspect that there are. This is the lack of trust that seems to be coming through. Now, this is BBC Media Action here. Area of focus at the moment, there's several areas of focus, but this was the first one on their list. Global response to COVID-19. And BBC Media Action say, we support the independent media, essential to democracy and development. We inform, connect and inspire change in our audience, providing trusted information, stories and ideas that generate discussion and bridge divides. All sounds pretty good. Helping to save lives and improve health, protect livelihoods, challenge inequality and build more peaceful and democratic societies. Well, there you go. I mean, the question is, to what degree do people believe this? Because we also know that motherhood is a really good idea and apple pie tastes really nice. And this has come on the back of this that just came out a couple of days ago as well. This is the first part of the report I want to look at from the House of Commons, Health and Social Care, Science and Technology Committee's Coronavirus Lessons to be Learnt to Date. That has just come out a couple of days ago. So this is a group of British MPs get together in this meeting. They can say largely what they want, and they have done. So I want to just give a few sort of, well, we might look at this in a bit of detail over time, but I just want to give a few sort of tasters of what they're saying, really. And you can really see why this whole ethos of mistrust has developed. So let me just show you one other thing. This is from the Indian Bar Association. So the Indian Bar Association, as far as I know, this is still going, is actually taking to court a member of the World Health Organization. Essentially, the World Health Organization has been taken to court by the Indian Bar Association for allegedly giving out misinformation. So we have a reputable bar, the Indian reputable Bar Association, taking legal action against members of the World Health Organization, the chief scientist. I mean, this does not look good. Is there some fundamental problem with the World Health Organization? Well, that's what a lot of people are concerned about. So just a few pointers from this UK government report here anyway, UK MP's report. Again, why people aren't trusting anymore. In 2020, the UK did significantly worse in terms of COVID death than many countries, especially compared to those in East Asia. Now, we were talking about this at the time. In fact, I remember it well. I was thinking that we were talking about this and we said these numbers in East Asia are so good, can they be true? But it turns out that they were, that the information we were getting were accurate. From Vietnam, for example, and Taiwan, for example, that did immensely well in the early stages. The UK pandemic planning was too narrowly and inflexibly based on a influenza model, which failed to learn the lessons from SARS coronavirus 1 2003, Middle East Respiratory Syndrome 2012, and the Ebola outbreaks in Africa. So basically these MPs are saying, well, we were out of date. we weren't up to speed on this. You know, and there's people get paid a lot of money to be up to speed on this, but the MPs are saying we weren't. In the first 3 months, the strategy reflected official scientific advice to the government, which was accepted and implemented. Now, this is true. Now, this is not political because in the UK, both political parties were basically saying the same thing. Now, in the United States, that was different. There was a political divide. But it wasn't as if the government was saying one thing in the UK and the opposition was standing up and saying the other thing. But there's now serious questions to be asked by the scientists, serious questions to be answered rather, by the scientists who are actually advising the government. So the government thought they were following the science, but was the science correct? So the government were doing what the scientists said. When the government moved away from the contain strategy to delay strategy, that approach involved trying to manage the spread of the infection. And this is the key point that we're coming up to now. Through the population rather than to stop it spreading altogether. So they were trying to let it spread slowly. This has amounted in practice to accepting that herd immunity by infection was the inevitable outcome. And as I recall at the time, this is what the scientists, at least for a period of time, were saying. So did the chief scientific officer, the chief medical officer and the scientific advisory group for emergencies all get it wrong? Read that report for yourself, but the intimation to me is that these MPs are at least strongly intimating that. The UK, along with many other countries in Europe and North America, made serious early errors in adopting this fatalistic approach, is what they're now saying. Looks like the scientific advice was not as good as it could have been. And not considering a more empathetic and rigorous approach to stopping the spread of the virus as adopted by many East and Southeast Asian countries. So at the time we did say, let's look to Taiwan, they're doing it right, but our government didn't seem to do that. The fact that the UK approach reflected a consensus between official scientific advice and the government indicates a degree of groupthink. So everyone was kind of going along with it. If you Google AE-ASH conformity experiments, you find this. So one person says one thing and the next person next door, even if they think it's wrong, is likely to say the same thing until people end up talking complete rubbish. This sort of group think conformity that seemed to be going on, not enough questioning going on. Big part of the problem here is simply not enough doctors and scientists and healthcare professionals and analytical thinking people in the scientific areas in government. So many people in government have studied PPE, politics. PPE, I think it's politics, philosophy and economics. Fine in its own way, but it's not science, it's not medicine. A lot of people in government are lawyers, which is fine, but again, it's a different way of thinking to the scientific rigour, and you don't have that background. Although the way of thinking can be logical, you don't have that background, basic knowledge. That basic knowledge of science that can help to inform things. That's just sadly lacking in government. So perhaps an over-reliance on scientific advisors who it turns out are now being severely questioned in retrospect. A degree of groupthink that was present at the time, which meant we were not as open to approaches being taken elsewhere as we should have been. Why weren't we looking and learning around the place? Now, there's more to say on that. I think I'll leave that there for now. I think we'll leave time for Nigel to give our report on Australia now. But really quite a big problem we have now with trust and who's going to follow things, and the implications of lack of trust, as we've seen in the Russian situation, really could be quite significant. This, of course, has got implications way beyond the pandemic. Right, let's go to Nigel. Now, Nigel did record this a few days ago, but I think there's still lots of interesting things here from Australia. So, as always, Nigel, thank you very much.
Hello, John. I'm recording this on Saturday, the 9th of October in the afternoon. The figures I'm going to give you for the Australian update are as of last night, so Friday. So New South Wales, where Sydney is, which a week or two ago was running at about 1,500, is now down to under 600 new cases a day, which is a good sign. However, Melbourne, Victoria, which a while ago was sitting at 600 cases a day, has now got the dubious honour of the Australian record for the most number of new locally spread cases, and it was 1,965. So that is almost 2,000. Unfortunately, the deaths total yesterday was 16, 5 in Victoria, 11 in New South Wales. We've got in those two states 288 in intensive care, and 163 of those are on a ventilator. And some of the nurses that are caring for these patients, as they're being put on life support, they haven't been vaccinated. All bar a couple of them have. And some of these people are actually going, can I have the vaccination, thinking that it's going to stop them from dying or needing to go on life support. So that's just, terrible. People are just not getting the vaccination when they really should. So talking of vaccinations, I think that Australia has actually done reasonably well. So I'll just read these figures. Now, this is for over 16s. Although we're now giving it to over 12s, the figures seem to be for over 16s. So across the whole of Australia, people who've had the first dose is almost 82% of the over 16s. People that have had 2 doses is now just over 61%. Now, some states are better than others. For instance, Western Australia, which is where I am, we haven't had a very good uptake of the vaccine, purely because I think complacency. We've got no COVID here. I was actually speaking to someone not a week ago who said, oh, what's the point? We don't have it. I'm going to wait. And of course, I tried to explain that the longer you wait, the more likely we're going to get COVID, and then you've got to wait a while for that vaccination to take effect. So they're estimating that within 3 weeks, Australia will hit 90% first dose vaccination rate for over 16s, and 6 weeks time for 90% to be double dosed, so fully vaccinated. I think that's probably a bit optimistic. Because you've got what's called the S-curve. So it starts off slow, builds up, and then at the end it tapers off. And I think that's what's going to be happening very soon. So another bit of news is ATAGI, which is the Australian Technical Advisory Group on Immunisations, has now approved a third dose, a booster dose, for those people who are immunocompromised. So transplant people, people who've got cancer and on chemotherapy, radiotherapy, those sorts of people have been approved for a third booster dose, which can be had between 2 and 6 months after the second dose. I am expecting that later on in the year they may well expand that to include some of the more vulnerable people, such as the elderly like me. So hopefully we'll start looking at booster doses sometime Christmas time for an expanded population. One of the reasons I think that Melbourne has done so badly is a week or two ago, and you know how it takes a week or two for the disease to be passed around, they had some massive demonstrations against vaccination, against lockdown, against anything, basically. There was actually a lot of the right-wing people, shall I say, trying to break into these and stir up trouble. And they became quite violent. A lot of police officers ended up in hospital with injuries. And I think that they carried on for days and days and days. And I think that these were basically super spreader events. I think we're going to see that hit over 2,000, and the hospitalisations will increase. The hospitals over there are beginning to feel a bit strained, and I think very soon that they will be stretched to the limit, and the numbers on ventilators and intensive care unit will go up. So I just thought I'd give you that quick update on Australia as a whole, how vaccinations do seem to have picked up quite a bit, except in some states like Western Australia. Obviously, New South Wales and Victoria have hit quite good targets, and New South Wales are beginning to open up as of Monday the 11th. And those that have been doubly vaccinated will be allowed quite a degree of freedom. So my son over there, he's having his second AstraZeneca vaccine on Tuesday. So as of about Wednesday, he'll be permitted to go back to work. So that's all good, because he's been out of work for the last 3 months since they locked down. So here's hoping that Australia is beginning to get a hold on this. International travel will start next year, fingers crossed. So thanks very much. I hope that you found that useful.
Thanks very much, Nigel, as always. Very concise update. So this local spread in Melbourne doesn't sound good at all. That's the genie's well and truly out the bottle there if you've got that much local spread. And amazing levels of ignorance. People don't know that vaccine is there to prevent disease, and it's no good waiting until you get it to get the vaccine. Dear me. Numbers going up nicely, which is good. Third dose in the immunocompromised. Well, that's just simple common sense. That's been going on for ages. Nigel thinks he might be getting a booster. If it's any consolation, Nigel, I will be getting mine in, also getting mine in November. Sad to hear about the political divide in Australia. We don't really have that in the UK, so I'm sad to see that this sounds a bit more like it's going the US route. So that's us for today. I've got a few more things I want to say on trust. I'll maybe talk about those again tomorrow. But I'm not quite sure we've got a solution yet, but it's interesting to think about the problem. Then we can start working on it. And you can see my thinking's not fully evolved. So we'll leave it there for today, and thank you for watching.